Since 1993, there has been in place the Dean Ornish program for the reversal of heart disease. This is an alternative to the traditional ways that we've approached addressing one of the greatest killers in American medical history, and that's heart disease. Our guest this evening is Scot Stangl, and he's going to tell us exactly how one of the largest insurance companies in the entire world got involved with an alternative healing art.
Thank you, Michael.
Thanks for being here.
It's a pleasure.
Why don't you tell us how Mutual of Omaha, an insurance company, got involved with something as a little bit alternative as the Ornish program?
Well, it's a real interesting story. A former executive from a large corporation here in Omaha had heart disease and actually went through Dean Ornish's program in California. In 1992, he approached our president, Jack Weekly, and told him about the benefits that he had gained from participating in this program, and told him that he thought that this was something that insurance companies needed to embrace. Healthcare was in a crisis. The cost of taking care of people with heart disease was just going through the roof, and he thought that this was something that at least merited a look. Jack Weekly, our president, then assigned the task to our corporate medical director, Dr. Ken McDonough. And Dr. McDonough and myself reviewed some of the literature that Dr. Ornish had put together. And it's a real key that when you talk about alternative medicines, I think that's the key to Dr. Ornish's success. He did those research studies that proved that his methods were successful and were efficacious. We reviewed the studies and found them to be absolutely above board, statistically significant, went out and participated in the program for a week in Sausalito, and found out that we felt much better, that we felt wonderful. Individuals.
You did the Ornish program?
We did the Ornish program.
Okay.
And felt wonderful. It was just incredible. We went a step further, though, and we interviewed patients who had been through the program to see if these were lasting effects and these were lifestyle changes that they could make and keep. And we found that they were indeed lasting effects, and that the way that people felt was such a motivator for them to continue to participate that we embraced the program. This is something that really does work. I think some of the problems with alternative medicines and gaining acceptance is that the research is lacking in a lot of instances, and I really have to give credit to Dr. Ornish. That was his real brilliance, was to prove that it was effective by doing those well-controlled studies.
Mm-hmm. My question is, are these reasonable lifestyle changes that you can ask a person to make?
We found then, and I'll have to say that we're finding now with the current project and the research that we're doing on the patients that are in the program, that these are indeed lifestyle changes that people can make and continue to make. We were a little skeptical when we went to California. Dean refers to California as the altered state, and we thought that we might encounter some people that didn't represent just the standard across-the-board American citizen, and
okay.
We found out exactly the contrary. These were very down-to-earth people who had made these lifestyle changes and felt wonderful because of them.
So what you found out in California were that these weren't a bunch of bean sprout eating,
yes,
yoga
exactly.
hippies. You just found a broad spectrum of
right.
just plain old folks who had given up on the idea of surgery and drugs
right.
and gone over to these lifestyle changes.
Absolutely. Uh-huh. Patients need to adopt all 4, or some would say 5 lifestyle modifications. Well, the 5th would be smoking cessation.
I see.
And if they're not able to do all 5 of those, then they're really not an appropriate candidate for the program.
Okay, so those 4, let's reiterate those 4, and the 5th one being stopping smoking.
The first is diet.
Okay.
Less than 10% of the calories from fat.
Mm-hmm.
The second is exercise, which is really an interesting departure from standard Western cardiac rehab, which is exercise-based. We found that with the Ornish program that exercise probably is one of the least important of the 4 components. And in fact, that he requires that patients exercise, usually walking, just 30 minutes a day. So it's not a real strenuous exercise program.
Well, that's something anybody can do.
It is, absolutely. Stress management, that does include meditation and yoga, and group support.
Mm-hmm. How are we measuring our success now after 2 years?
I'm glad you asked that. It's really very easy. When you consider that an angioplasty costs our company on average $21,000, And a cardiac bypass costs upwards of $52,000 per occurrence. And then you realize that patients who have angioplasties, 40% of them need to have another angioplasty within the first 6 months. The mathematics become pretty simple, and then you take into account that the Ornish program costs $6,500. And it's very easy to figure out why the bottom line people are interested in this program. We did an original cost analysis. If you can prevent just 10% of the patients that are in the program, if just 10% of those, you can prevent them from having an angioplasty or bypass, the program pays for itself. 10%. And that's a win-win-win situation. The insurance company wins, the patient wins because they don't have to have their sternum split open, and the hospital wins. They get to expand their services that they can offer to the community.
There are going to be people who need angioplasties.
Absolutely.
Regardless. That then opens the door to calling this complementary medicine.
Right.
You know, if you're sitting there and you've got a major problem, you're not going to start talking about, you know, changing what you ate for breakfast.
Exactly. Dr. Ornish, I think, says, and I don't know if Dr. Collins said this, but he once said that if he has a patient in the emergency room with chest pain, he's not going to prescribe broccoli.
Right.
He's going to give them nitroglycerin and use standard Western techniques.
Right.
This is a program that isn't for every single person, and I think that makes it a little less threatening.
It does require taking responsibility for
Absolutely.
yourself, doesn't it?
Yes, it does.
And that shifts the whole focus from, here, doctor, fix me, to show me how I can fix myself. Is that what we're seeing, that shift?
Absolutely. Something has to change, and I think that these types of programs where you can help patients gain control over their own illness are certainly one of the ways that we're going to be able to make healthcare work in the United States.
How are you reaching out to physicians, letting them know that this is working?
Much of it is PR. We do have communication with the physicians that are in our network, the physicians that are in our HMO network that we contract with, the physicians that are mutually preferred that we contract with, and we communicate to them fairly regularly about the program and what type of patients it's for and the early success that we're seeing with the heart trial. With regard to other physicians outside of our networks, we really don't actively pursue them to communicate the program, but I'll have to say it's been the case that we've got more applicants than there are slots just based on the amount of publicity that we've gotten so far.
Really?
So we've been very fortunate in that.
Are you at liberty to mention any of these famous people that I know that have sort of skated through the Ornish program?
You wouldn't be talking about Tom Osborne, would you?
Tom Osborne, the name
Yes.
rings a bell.
Yeah, it's kind of interesting. We like to take credit that that the national championship eluded us for several years until Tom got on the Ornish program and we were successful. Now, that might be a little big-headed of us, but...
Now, just philosophically speaking, where do you think we're going to end with this?
I don't know where we're going to end up. I think that on the continuum, we're going to move much more towards the side of personal responsibility for health. I think that people have to realize that if any of this is going to work, that they have to be the ones that are primarily responsible for their well-being, and they can't look to physicians and insurers just to save them from drowning, so to speak, once they've already gotten into trouble. And we're seeing that. I think ultimately it lies with the patient. I really do, and we need to convince people of that.
So the first shift is to see the physician as an adjunct to our health rather than the source of our health.
Absolutely.
Great.
Absolutely.
We appreciate your input. We appreciate you telling others about our program. So until next time, be well. Good night. Thanks, Scott.
That went great.
Good.
That was
good.
Nice.
Yeah, I love doing that.
Yeah.
Heartland Healing is a production of Heartland Healing Center Incorporated, a nonprofit corporation in the public